Hi, I'm Christy Truesdale, Deputy Director of the Children's Environmental Health Network. As part of our week-long event series celebrating Children's Environmental Health Day, today's focus is on children and nature. If you haven't already done so, take our pledge today and head outdoors or engage in a nature-oriented activity with the children in your life. But first, join us for the Nature, Equity, and Children's Health film screening, followed by an expert panel discussion on nature's health benefits to children and strategies to provide children with safe, equitable access to nature.
Hi everyone, it's Erin. Today I'm going to be doing a little bit of work in a cubicle. We are the first indoor species. We spend about 95% of our life inside, and if that's surprising to you, you're not alone. Put another way, we are spending about 22 hours a day inside. Even today's kids spend half the time playing outside compared to their parents. Oxford Junior Dictionary sees this trend. They've replaced the word beaver with blog and completely taken out fern, lobster, sycamore, and dandelion. That's a change. For the first time ever, more than half the world's population lives in cities. Cities are designed to get us from building to building, but what about nature? What about the outdoors and the wild? What if we're all living in cities and we don't really get outside anymore? Hey, I'm Erin, and I'm a travel photographer and writer, and I want to know what the future of the outdoors looks like. Hey everyone, so I just landed in Chicago. I've never been here before, and I'm excited to be experiencing a new city. It is beautiful here. So as much as I love beautiful buildings and beautiful cities, there aren't a lot of natural spaces here, but it looks like that is changing. Sunshine, trees, walking. You may have felt that getting outside is good for your health. Like for me, I have to go outside to calm down, to feel better. It's necessary. But it might be necessary for you too. More and more studies are showing that lack of direct sunlight causes health issues, such as vitamin D deficiency, which can contribute to tiredness, fatigue, and low mood. And it's easy to see why in a city. I mean, it's artificial light, you're not seeing nature, you're not seeing the sunrise or the sunset, and there are some days when you might not even get to experience the sun. So I get it. This isn't only mental. Dr. Levine of Arizona State University claims that we have created for ourselves a modern way of living that clashes with the way we're meant to be. And his studies have shown that the more sedentary we are, the more at risk we are of sitting ourselves to death. Which is kind of terrifying, but maybe it's the wake-up call we need. So since we're all moving towards cities, could we design them to help us get outdoors? I wanted to go to 3 cities across the country that are taking back access to wild spaces and making sure anyone can choose to get outside. What happens when people start dreaming around an old industrial site? Big Marsh is a steel mill turned bike park in the southeast side of Chicago. Located on almost 300 acres of open space, it's helping to contribute to the creation of an outdoor recreation hub just 25 minutes from the urban core of Chicago.
My name is Stephen Bell. I'm the center director at Big Marsh Park. In the past, before the Park District took it over, the site was used as a dumping ground for byproducts of the steelmaking industry. So all sorts of stuff, whether bowling balls, we pulled cars out, mattresses, box springs, like you name it, it's dumped there.
So I'm with Chantel. Hi! She's gonna get me on a bike. And she will find out how coordinated I am, or uncoordinated. So for anybody into biking, this is huge because there are so many tracks to explore. And it's just so nice to think that people can be getting outside in a place like this in the middle of their city.
My name is Brenda, and I'm actually from this area here. The fact that it's outdoors and in an urban area, we don't have many forest reserves in our city. It has its own psychological effect on you and its own healing effect on you, just enjoying the outdoors.
This area, which had no use before, is now being really repurposed into something that everybody can enjoy. And this is basically right out my back door.
Okay, so there are also 4 other past industrial lands that will eventually all be connected, creating a place to bike, hike, paddle, and climb, all within the city of Chicago. But for many, urban living means urban transportation, and that means not having access to a car. This makes accessing wilderness spaces incredibly challenging, especially in places like LA. But what if cities helped make that easier? Okay, this is me. Last year, LA made a bus available to take hikers specifically to hike from the city. So I took the bus from a suburb in LA to the San Gabriels. I am on a bus right now up to Runyon Canyon, which is a hike close to LA. So I just got dropped off by the bus, and the hike is just up here, a few blocks. People are excited about the opportunity to access the mountains. The Memorial Park to Sam Merrill Trailhead had over 9,000 riders from April through August. Which all just goes to show that we are homesick for our natural habitat and that it's time to change course. While this is nice, not everyone has time or mountains nearby, even if they want to get outside. And that's where commuting comes in. DC's Capitol Trails Coalition is creating a 20-year plan that will create one of the largest trail networks in the U.S. This regional initiative helps connect over 700 miles of trails.
My name is Katie Harris, and I'm the Trails Coalition Manager. Our roadways are more and more packed every single day, and so it's really important for us that we're building systems where people don't have to rely on their cars. They can rely on walking and biking and transit.
People now, they use trails to commute to work, recreationally, just to be outside. The trails aren't just for transportation. It's about public health. It's about having greener space. It's about the environment.
Trail networks are connecting people to the communities, to other communities, and then in turn to the businesses and people that reside and work in those communities.
Other cities are starting to take notice of the benefits of green spaces, like the Atlanta Beltline, the San Francisco Bay Area Ridge Trail, or New York City's High Line. We know that our natural habitat is good for us. It's even been shown that patients with a hospital window and daylight have better chances of healing. Sitting in a cubicle and just sitting indoors, some of it is unavoidable, of course. We have jobs or we have responsibilities, but let's be making an effort to get outside and get back to our nature. So one example of this is a sunset. It happens once a day, right? It's beautiful. It puts you totally in the moment. So when was last time that you stopped and saw one? Thank you all so much for watching this episode. We were really excited to share it with you, and we're really looking forward to covering some interesting topics in the outdoors, things that you care about. So whatever your comments are about this episode, we would love to hear them, as well as any future ideas that you have. So leave them in the comments below, and we'll see you next time.
Why are you taking video of yourself?
Because it's part of the movie that I'm making. Okay. Hi everyone, I'm Erin, and this is my friend Eva. Can you say hi, Eva?
Hi, Eva.
Eva's your average 3-year-old. She likes to create and play and imagine and explore and run around. Like a lot of running, which would be a nightmare for your average preschool. But this isn't an average preschool. There are no desks, no fluorescent lights, and no building whatsoever. There's a new movement of outdoor preschools sprouting up around the country, and it might be the wave of the future. Hey everyone, I'm Erin, and I'm interested in seeing what the future of the outdoors looks like. Hi everyone, I just got to Seattle. I love this beautiful city, mountains, and the ocean, but of course it is still a city, so you have concrete and indoor spaces, but there are some parents and preschoolers who are wanting to make sure they stop and smell the roses, or know the roses closer, like more than just seeing them. Anyway, check out what I mean.
It's hard to think about your own work in such a noisy room. You couldn't learn very much here. Let's visit another room. It's so quiet. A good room to work in, to learn in.
So let's back up. Knowledge has been passed down outdoors since time immemorial, but over time we've moved children's education from the outdoors to inside four walls and under fluorescent lights. However, it surprised me to learn that this trend of getting children's education back outdoors was started back in the 50s. We first started to see nature being incorporated into a curriculum in Denmark. And soon, mothers begin organizing schools that bused their children from Copenhagen to the countryside. But it took a long time for this to catch on in the States. In fact, it wasn't until 2010 that these outdoor schools really started to show up. And now there are more and more. In 2016, there were 150 nature-based preschools and kindergartens across the country. And then just 1 year later, there was a full 100 more. Now there are nearly 500, which means more than 10,000 children are enrolled in these programs. These new schools are called nature preschools or forest preschools and are based entirely on the idea of getting kids to learn through nature as the organizing principle of the programs. So where did this idea come from, and why is the trend growing so fast? Well, a lot of people point to Richard Louv as one point of inspiration in the US. Richard has been writing books on nature and children for over 20 years. His book, Last Child in the Woods, speaks specifically about where our future is heading and why it's so important for children to connect with their environment. So I wanted to spend some time with Richard at his house in California to learn more about what he has seen. So obviously the book is about the importance of children connecting to nature. And this went on to be a bestseller. People love this topic. Why do you think the book and the topic took off?
I noticed in my interviews with families that something profound was changing in the relationship between children and nature. The parents knew it. Again, they couldn't quite describe it, but they didn't understand why their kids weren't interested in going outside. As one little boy said, I prefer playing indoors because that's where all the electrical outlets are.
Right, I was reading that in Last Child in the Woods.
I heard that again and again. And finally, the academic world began to pay attention to it because now there was scientific evidence that was backing that idea.
What Richard saw was echoed in many other studies, like how today's kids aged 6 through 11 spend an average of 7.5 hours a day being inactive. And of kids ages 9 through 13, only about 6% of them will go out and play on their own. Instead, the average American child today spends up to 9 hours digitally connected. Which maybe sounds like a bunch of folks saying, kids these days and back in my day, but maybe there's a warning in what we're hearing.
Nature deficit disorder, well, it's not a known medical diagnosis. Maybe it should be, but it's not. That opens the conversation about what happens when we are disconnected as a species and as individuals from the rest of the natural world. What happens to our health? What happens to our physical health, our psychological health, and our spiritual health?
Richard believes that the more kids are outside, the more they will be grounded and the more healthy they will be mentally and physically. And he might be right. One study found that low access to residential green space can be connected to psychiatric disorders from adolescence into adulthood. And another study found that increased exposure to nature decreases or can reduce ADHD symptoms. Now, getting your kids outside today sounds like a fun, cool thing to do. But what about grades and learning and the alphabet? What do these schools even do? How do they learn? Okay, this is Tiny Trees Preschool, and we're only about 5 minutes from major Seattle freeways, but in here, I feel completely engulfed.
So I'm Kelly Morrill. I am the executive director of Tiny Trees. So we're different in that we're outdoor. We don't have walls, so all of our children are in public classrooms. So children at Tiny Trees are learning, they're learning about science, they're learning about resilience, they're learning about self-regulation, they're learning great social skills and even academics, all in an outside environment just by playing and engaging with nature and with each other. And through the facilitation of the teachers.
I wanted to talk to some of the parents at this school to see what they really think.
I think just being able to be outside and moving their bodies all the time with all of their little friends and learning from their teachers outdoors has been so much better than being inside all day would have been for them.
With this, the kids are up and around and they're not learning that they're supposed to be sedentary and they're not getting yelled at to stay in chairs, and it's like they have to stay in the area, but they're allowed to wiggle. And that's how we're supposed to be naturally.
But the real question is, does this work? Or will kids be staring down their SATs, only remembering what tree is outside the window? For that, we turn to the researchers. Dr. Tandon has done research on kids in the outdoors when it comes to learning and physical health.
Physical activity is important for so many reasons. There's the obvious ones like a healthy weight status, healthy heart, bones, and all that. But getting enough physical activity can also be important for things like mental health and even learning and academic performance. One strategy for getting kids more active is to have them be outdoors more. So research suggests that when kids are outdoors, they are running around more, they're moving more. So how do we get kids outdoors, whether they're in preschool or at school during recess, PE activities, and in their neighborhoods? So having access to parks close by and that feel safe enough for kids and families to be in.
Well, this is a feel-good story, isn't it? Let's make all schools outdoor schools. Kids know the names of plants. They want to befriend slugs. Well, there are some barriers to outdoor schools, and one of them is permits. In Chicago, one school is being closed because it can't maintain a permit. The Child Care Act of 1969 requires that preschools be in a physical facility, something that doesn't really flow with the whole idea of forest schools. Another major roadblock is that laws require preschools to be secure from the public, and since these schools are in public parks, technically anyone could march on through. One critique of these programs is that historically they've been accessible largely only to white upper middle class populations.
When people think about outdoor preschool, they're thinking about little white kids running around in the forest. It's a very niche space to exist in, and so within that space, you would want to see the children who are in those spaces at least being representative of the demographics of the areas that they're living in. And so that means that we need to become better community members. We need to be talking to people more. We need to be listening to people more and figuring out how we can do our best. That means that we come back and then we're reflective and we figure out what we need to do to make sure that when we do partner with someone in the future, we're being as thoughtful as we can.
If states aren't providing permits, it can be hard to get a grant in order to assist lower-income households. Colorado and Washington are the only states as of now that are expanding the law so that licenses can exist for forest schools like Tiny Trees. All to say, there is still a ways to go in getting the class demographics to accurately reflect the diversity of the places where they exist.
Cedar, maple, hemlock, and a Douglas fir.
After spending my whole day with these kids, it really seems like an outdoor focus for our schools is something we should be fighting for.
There's growing awareness that being outside in nature is a great place to learn about everything, not just about science, not just about nature. Partly because it stimulates more of our senses than we get from a computer. Our kids are spending that much time blocking out those human senses. Isn't that the very definition of being less alive?
The really cool thing about doing preschool outside is that we're not confined by walls. We are able to get our inspiration from everything that's happening in the park. So the learning is 100% relevant to them and to what they're experiencing every day. And it's pretty awesome.
The added benefit here is not just that the kids learn, but that they build a connection to nature that lasts into their adult years, and maybe that they teach their parents a thing or two about caring for the planet.
I hope that it will always be important to them to be a steward for the environment. I hope that having that really solid base of that from preschool, that it'll just carry throughout their life and they'll always come back to that.
As the next generation grows up in a world that's increasingly digital and connected, maybe it's time to reevaluate our education system and use it as a tool to reconnect us with our natural habitat. And even though there aren't walls or ceilings, kids are still learning. And after spending the day here outside, playing in the mud and singing songs, all I know is this is the education I wish I had, and maybe the one I still need.
The stinging nettle is not good.
Stinging nettle is not good.
Yeah. No. It tasted for a long time and we knew it.
Hey everybody, thank you so much for watching. We had a ton of fun hanging out with these kiddos. They are hilarious. And we also just wanted to let you know that you may have noticed a little blurb on one of the corners here throughout today's episode. That's a land acknowledgement. We want to acknowledge the land that we're on. This is also feedback that we got from you, and we totally agree. So you're going to see that from now on so that we're acknowledging whose traditional homeland we are filming on. As always, let us know if you have more feedback in the comments, and we'll see you next time.
John Steinbeck called them ambassadors from another time. They are the tallest trees in the world. They grow nowhere other than here.
You get that humility of being among these incredible giants that have been around for millions of years.
I felt so full of gratitude.
I just feel a whole lot healthier.
It's a privilege to be out here.
It just feels really alive.
It was just
being
so
here.
giant.
It's extremely
It
humbling.
humbles you. Man, this right here is like the closest you can get to like magic.
The redwood forest is unique around the world. And when we were founded 101 years ago now, it was at a time when the rate of harvest of the redwood forest was extraordinary. Say the Redwoods League learned about a remnant stand of old growth that was hidden.
For years, there were whispers of a hidden grove nestled in the hills above California's Sonoma coast. A mythical place where you could walk among giants, the stuff of legend, until now.
It blew my mind when we got this under contract because I had heard that it was old growth, and I've heard that term thrown around very loosely. This is 700 acres of old growth redwood. There is nothing else like this that's still unprotected.
Some of the redwoods in this forest have been around since before California was a state, before the fall of the Roman Empire, and they're still growing.
The redwood forest is 600, 700-year-old trees. But dappled in that forest, there are 3 or 4 monsters that are over 1,500 years old. There's one tree out there that is 1,647 years old. It's the oldest coast redwood tree south of Mendocino County, and we didn't even know it was there.
Save the Redwoods League posted on Facebook. I started reading up on it, and I was like, wow, that'd be awesome. I sent an email to Sam.
I got an email from Teresa a little while after we'd announced the purchase.
In that email, I asked, I'm aware of this reserve that you guys are about to introduce to the public. Give it to me. Let me do it with a group of people from underrepresented communities. And he said, let's talk about it. Go to social media, pull up any brand. What images do you see? More than likely, they are not people that look like me. That's the why. I think all too often, people forget that communities of color have always been in the outdoors. But through generations, some of us have been removed. These are people that work on these issues day in and day out, but you don't see us. We're in the background having these conversations. We're not out front, and that's the problem.
Let me welcome you all here. My name's Sam Hodder, and we are standing on the ancestral territory of the Kashaya Band of the Pomo. Teresa's assembled a group of community leaders, outdoor advocates.
You have people from various underrepresented communities that can speak heavily to these issues, sharing why it's important that they are represented.
It's not just one group of people that are using these public spaces. There's so many ways that the forest serves different populations of people, and we want to incorporate that in what we do going forward.
This is really the first opportunity to welcome a community into this property. We recognize that we have a lot to learn, and today is a big part of that. What an amazing opportunity to learn from one another about how to deliver that public value in a new day.
When the white man first came to North America, a great part of the continent was clothed in majestic forests.
If we go to the mid-1840s, there were 2.2 million acres of old-growth coast redwood forest that really defined California's coastline.
Trees flourished in countless numbers.
And all of a sudden, the gold rush.
The loggers slashed into the virgin forests with little or no thought for the future.
As San Francisco and other Bay Area cities started to grow, the population numbers were exploding.
And all in his day's work, over goes the top of this tree.
From small little communities sprung a full-fledged city in a matter of a decade.
Then they begin their cutting.
And it was a city built entirely out of redwood.
Cutting their way into trees that may be as old as our civilization. For the redwood trees of California are probably the oldest of living things.
The old-growth coast redwood we came really close to losing altogether.
It was just so cool being in the woods with a bunch of people of color. That's just magical.
I just really think we just need to acknowledge that, folks of color have always been a part of the conservation movement.
I have been pioneering as a person of color in the outdoors since 1996. And I still get some under-the-breath remarks, or people will say something really racially aggressive and offensive.
The more we show that we're out here and that we've always been out here, the easier that I certainly hope that it'll be for folks coming after.
Wow.
Yeah, that's from the, what did she say, great horned owl that lives up there?
Wow. That's cool. There's a big one. You see that one right there?
Yeah, oh boy.
I would say that this is a forest built on resilience, that this is a forest of consistent regeneration. And I think there's a lot of hope in that.
It's just a reminder that we are standing together, holding each other up, kind of like these trees are.
Yeah, this is back to this one, right? This is starting. I can't even touch both sides of this.
The land is so ingrained into our identity.
When we're talking about conservation, often it's been approached from let's remove people, let's remove indigenous people.
And that disconnect, I feel like, is a piece of how we lose our identity.
I think that's a big shift we need to make as a whole community. How can we protect this place with people?
That was just such a cool feeling.
The service that our parks are providing, redwoods and beyond, are fundamental to a healthy society and livable communities. Reimagining how we welcome a diverse public is fundamental to that.
To be not only invited in, but to be welcomed in.
It's putting the message out there that this space is your space.
For sure, I felt really safe. It gave me a lot of hope because there's people trying to do things differently.
It feels that I'm seen and I'm valued.
It's an honor, and also why doesn't this happen more?
There was just a lot of honesty and open conversation.
It really is a step in reconnecting folks to their roots. A big piece of what I feel like is missing, especially in my community.
It's still making me smile inside.
It can, for many people, seem like a box-checking exercise where we're just saying, we talked to these people, great, we did it, let's go back to what we always do. This is going to impact how I do my job.
Without having proper equity in spaces, it's going to continue to reinforce systematic racism.
So re-including these voices and reclaiming that space for ourselves is essentially the way to move forward.
We need future leaders that represent the communities that we look to.
So that we can all be the stakeholder to make sure this place is going to last.
You have this awesomeness coming in from so many different places.
If that can happen, then that can change everything on a systematic level.
So I think it's important that people see us. They see beyond the lens they've always looked through when they see someone that cares about the ocean, the mountains, the forest. And they see me, they see Jose, they see Amanda.
It's time for us to reimagine the role that our parks play in a very different California. We want to be a partner in that.
We all exist on the same planet. And as a collective, we can all do this together.
Outdoor recreation is so often seen as something that is a privilege or a luxury. But really being in the outdoors is more than just a nice to have. It's really critical. It's essential to our health, to our well-being, to our joy, to our resilience. So this year, it hit deep. Seeing Ahmaud Arbery shot and killed while doing the sport that I love. The apathy, I would say, of many communities around America hit hard. Literally that weekend after George Floyd was killed, I ran up to Cuyamaca Peak and just looked out over San Diego to just kind of ground myself and get perspective. And what I saw was that powerful healing effect and resilience building effect of being in the outdoors in my life and in helping me to overcome a lot of the adversity that I had experienced in my childhood. Here we go. So my dad used to dress me to the nines to go to school. It was ridiculous. So literally I got the nickname Suspenders in elementary school. We grew up in a suburb in New York, but also had a very strange childhood at the same time. Back then, we didn't really talk about it or define it as mental illness. What I did know was that my mom, she struggled in raising us, and she became homeless. I remember nights waking up, wondering where my mom was. And I remember it just being difficult explaining it to friends. That's hard. It was hard knowing that your mom, who was such a beacon in our community, Columbia-educated nurse. Even as I got older and, she wasn't there throughout many of our developmental milestones, your mom is still your mom. Yeah. People have different choices and take very different paths. It's more than a nice to have. I've definitely needed space to be able to pull back, pull away, to find my own healing so that I could be able to better show up for the communities that I serve and that we serve.
Morning, morning. Wait, drop this.
No, not today.
I bet you're here.
All right, we hiking, y'all. Watch out for poison oak. Oh, this is scenic.
No. Yeah. Drop the boat. I know it's stopped.
Yeah, like, okay, there it is.
I want for them to experience joy. My hope is that every kid at least has one moment of joy that sparks something incredible in their life.
It's like those first moments are, I think, very special.
By the ocean, sleeping by the ocean, just hearing the waves. To see how her attitude just changed from that, like just that little outdoor experience.
I don't know, just being out there, I feel more like connected to myself.
Seeing just how untouched some of the world can be.
My job is empowering the next generation of leaders. It's important for the youth to have access and to know that they have access to these outdoor spaces because in so many ways being in the outdoors is healing, is health, is well-being, is mental health. And so a lack of access, I would say it's like taking away opportunity. It's like taking away opportunities for joy.
Yeah, I didn't have that growing up. It was very much hustle and bustle, survival mode. Let's figure out how I'm going to eat today. Let's figure out, if I can take some food from school so I can have food over the weekend. Let's see if my mom's going to the hospital today, if she's going to be drugged up, who's drinking, who's screaming, if we're going to have a place to live.
Yeah.
You did a great job.
I did an awesome job. Thank you.
She does do an awesome.
I know, right?
How many classes?
Over 95% of the kids that we work with are living in poverty. Many of them are experiencing community violence. Many of them are experiencing violence at home or substance abuse and addiction.
When you get on the bike, make sure you're comfortable, make sure that your seat is adjusted.
For me, my brain just never shut off. It was always something. It was just this constant whirling of like panic and anxiety and fear.
I definitely think that, I see myself in so many of these kids.
Try and swing your right leg from
I remember camping in Joshua Tree for my first time. It was my first time camping, first time pretty much everything.
I'll never forget my first time climbing Mount San Jacinto.
Getting at the top of that cave scramble.
After that last bit of scramble, just standing at the top.
And you could literally just see the whole world.
You just experience a sense of joy and accomplishment.
The first time where I had felt like the world is okay.
Just feeling like anything was possible.
Like it gave me the opportunity to build something within me that was stronger. For me, finding the outdoors and finding that inner peace, all I wanted to do was make it so that people could find that too.
Go ahead, I have your bike. You're not gonna fall.
There you go. It should be on flat land.
Woo!
It's crazy. Resilience has kind of that domino effect. When one person experiences resilience, they're able to then help tap into the resilience in others, and they pass that on. They pass along that mentorship. They pass along that opportunity. My mom, her mental illness and the impact that it had on me and my siblings. When I was younger, it brought up uncertainty. Now I would say it brings up purpose.
You want a real challenge?
Okay, what?
Go dance out on the
No.
Growing up poor, you don't have the most access to let's say a beach or a hiking trail. So that's your walk going down the liquor store.
The outdoors is so critical and essential to our health, to our mental health, to our well-being. And the fact that it's treated as a luxury is one of the greatest disservices to our communities.
Allowing people who come from neighborhoods like mine to just like get out there and see what's possible. They're able to define their own experiences and be a different person. I want to be safe for my mental health. I want to preserve myself. The outdoors for us was like our safe haven. Just seeing how, like, yes, you were born in that neighborhood, but you don't have to be the stereotypical person within it.
I came bearing gifts. What's up, Greg? When you consistently don't see yourself represented in outdoor spaces, it never quite clicks that I too could be there as well. Many of us are working to increase that representation to then open doors for many others.
Sometimes when we are told that we can't do something, we really believe that we can't. But then when you see one other person who's capable of doing something, it broadens your potential.
Joe's Crab Shack and back, about 3 miles, 3-mile run. Decided to come down here, downtown today, have a little fun.
Coming together in groups like Black Men Run and The Nod has really been a healing and restorative place for me. A place for me to grow, a place for us to support each other and uplift each other. In so many ways, there's a traditional way to be in the outdoors. In order to increase diversity in those spaces, we have to kind of open our minds to just different ways that people can seek and experience joy in those spaces.
I just prefer, like, you should take lessons, you know, and I can teach you, you know. Oh gosh, Les, I'll help you, you know. Little 2-step, like no.
I love to dance. It's my way of knowing that I'm still alive and that I'm vibrant. I think that it's important to really depict joy in the outdoors. That one moment of joy has the potential to spark curiosity, spark possibility in what they can do and what they can be in the future. That experience of joy has the ability to be incredibly transformative in their lives.
Welcome, everyone. Happy Children's Environmental Health Day. I'm Leyla McCurdy. I'm a member of the board for Children's Environmental Health Network, and it is my pleasure to serve as the moderator for today's panel discussion, Nature, Equity, and Children's Health. Now it's my pleasure to introduce our amazing panelists for today's discussion. Dr. Robert Zarr is a pediatrician at Unity Healthcare, and he's the founder and medical director of ParkRx America. Lesford Duncan is senior director of programs at Outdoor Outreach. Priya Cook is the Green School's yard consultant at Children and Nature Network. Lexis Morrow is the development coordinator at Outdoor Outreach. And Tatiana Butte is the 2020 Outdoor Retailer Inspiration Awards Youth Category winner. She's a student at University of California, Berkeley, and she's with Outdoor Outreach. Spending time outdoors in natural environments has many health benefits. And children enjoy greater physical and mental health and well-being when they have access to natural areas, such as parks, gardens, greenways, naturalized schoolyards and playgrounds, and natural landscaping around homes, schools, and other spaces. However, we know that access to nature is not equitable. Children of color, Indigenous children, and children in under-resourced communities have less access to nature and often feel less safe and welcome in nature than white and wealthier children. Today, our panelists will delve into these topics and discuss how spending time in nature improves children's physical and mental health, how spending time in nature helps nurture the next generation of environmental stewards. They will shed a light on disparities in access to nature and how this inequity increases health disparities. And they will share different approaches to increase equitable youth access to outdoors and nature. Now, I would like to turn it over to our panelists to make some opening remarks. And then we will have a discussion following these opening remarks. I would like to first invite Dr. Robert Zarr to talk about his programs and some of the topics that I had tried to summarize. So Robert, please tell us about what you're doing and why this is so important.
Thanks so much, Leyla, for having me, for the invitation, and good morning to my fellow panelists, and good morning to our listeners. It's a pleasure to be here. I'm sorry that I'm actually not on the beach. I'm in the north, as they call it up here in Canada. Just to begin with, a little bit about myself, so you have a little bit of perspective in terms of where I come from. I have been practicing primary care pediatrics for a little over 20 years at Unity Healthcare, which is a federally qualified health center. It is in Washington, D.C., and I have seen a largely low-income, inner-city, immigrant, and very much a people of color community for all these years. About 10 years ago, I was at an American Academy of Pediatrics conference, and I heard Rich Louv speak, and that was really one of my first sort of dives into nature and health. And I met Leyla about that time, might have been actually at that conference as well, and she and I hit it off, and I sort of started to do some soul searching in terms of, you know, why hadn't I known about all this connection between nature and health? And I quickly came to the conclusion that you know, rarely in your life, and certainly in a life of a pediatrician, do you find such an elegant and simple, should I say, solution, or maybe even better than that, is an intervention that addresses such a wide swath of problems. And we know now we have hundreds and hundreds of studies that have been published, some fantastic, some clinical trials, some correlational, all kinds of studies across the board. And those kinds of studies are really important for physicians and healthcare professionals like myself to provide that kind of evidence and background as to maybe why, you know, and how nature can be an intervention. I was also lucky to not have to start from scratch, even as far back as the Healthy Park, Healthy People in Australia, the concept of park prescriptions, which is now really known as nature prescriptions in many communities, was already there. So I just had to kind of pick up and run with this. And that's sort of what I did. I got back to DC and in Washington, DC, and I thought, how do we put this into practice? I met some wonderful people along the way. I can't name all of them, but certainly Dr. Nushin Razani and Dr. David Sabgir, and I mentioned Leyla, Ann O'Neill from the Park Service, many, many others really sort of showed me like this can be done. And so I started out really making relationships with the people in my local community, including my community health center. Unity serves over 100,000 patients, so almost 1 in 6 or 1 in 7 people in Washington are patients of our community health center. You know, I have lots of colleagues both at Unity and you know, around the city, and so we started basically prescribing nature. It was very, you know, sort of do it as you wish. It was very open-ended, not a lot of structure to it, and very organic in that sense. I pretty soon realized that we need some structure. So DC ParkRx morphed into something that we call ParkRx America. I'm the founder, as Leyla said. And a lot of what we do, and what I have sort of led the effort in my small nonprofit, is to encourage and educate fellow physicians, fellow healthcare providers, not only here in the US now, but around the world, as to how this brief physician intervention can be done in a minute or two in a routine clinical visit right there in the office as often as you want. And that, I think, is where we are today. We have over 1,200 healthcare practitioners, educators included in this, who have joined our nature prescribing platform, which is wonderful. We've done hundreds of trainings, both in the US and around the world. We've given lots and lots of talks and participated on panels. So we've really done a lot of media as well to really get the word out there that this can be done. As of right now, it is still free to all healthcare practitioners anywhere in the world who want to use it. And we really boil down this concept of nature prescriptions into an actual prescription itself. And the prescription is very simple, but it provides structure. So it has a place, an activity, a dose, and a frequency. And both patients and physicians clearly understand the universality of the prescription. It is a contract, so to speak, between the patient and the physician. It is largely written by the patient and tweaked a bit by the physician to make sure we have the highest therapeutic yield. And there really are no limits. So when we say nature prescription, we really are training the doctors and healthcare professionals to do this in the manner they feel comfortable doing it, and also in a manner that is sensitive to our patients' needs and backgrounds. So here we are now, thousands and thousands of prescriptions later. I would be remiss if I didn't just mention that I am the co-principal investigator on an NIH-funded clinical trial right now looking at some pretty hard measures. So accelerometry, some biometrics that are mining from the electronic health record, and then a pretty heavy survey tool that we're doing as well. And we're looking at 500 participants over the course of 2 years. So we'll be very excited to share that, and I'm sure we'll be publishing as well for the world to see what we come up with. So thank you again for having me.
Thank you so much, Robert. Yeah, definitely what you're doing is a great model for all healthcare providers across the country. And you're basing it on evidence, you're creating more evidence. So there's definitely no reason to even hesitate to replicate this model. And it's a very, very simple model that can be integrated very easily, as Robert said. And our children need to be outdoors. And it's unfortunate that we need to do this through a prescription, but let's do it in any way we can, right? Thank you so much. So now I would like to turn it over to Lesford Duncan. He is with Outdoor Outreach, and of course, the other piece of this is the natural spaces. And we will hear from Lesford and some of the other speakers about how that piece is working so well in some communities. Thank you.
Absolutely, and thank you, Leyla, and good evening. By the time everyone is watching this this webinar, as introduced, my name is Lesford Duncan. I have the honor of working with some phenomenal folks at Outdoor Outreach, including Lexus and Tati, who you'll hear from in a bit as well. Just to give a little bit of background, Outdoor Outreach is a community-based nonprofit based in San Diego, where we've been working over the past 22 years to connect youth to the transformative power of the outdoors, helping them to experience the healing effect of being in the outdoors, helping them to experience the resilience building effects that come from being in the outdoors and having true sustained access to those spaces. And so each year we engage over 2,000 youth approximately each year through outdoor experiences such as hiking, maybe even in their local neighborhood park, to backpacking, to surfing, kayaking, stand-up paddleboarding, outdoor rock climbing, and so much more. But I think what's more important than the activity itself are the opportunities, to experience a sense of belonging in spaces where many of our youth may not have had access to in the past. Opportunities for them to challenge themselves by choice, but to be able to challenge themselves and to be able to overcome some of the fears that they may have had about different outdoor recreational activities. And then most importantly is to be in community with peers and mentors and instructors that are there to uplift them, to affirm them, and to be able to help them experience a new sense of possibility and confidence, not only within themselves, but confidence also to be able to affect change, whether it be at a micro level or on a macro level in the lives of others. And so I think Lexus and Tati have been two really phenomenal examples of youth that have come through our program and that are now leaders within outdoor outreach and beyond. And so I'd be interested in hearing a little bit more from them, and would be happy to share some more remarks later on in the panel.
Thank you so much, Lesford. That really sets the stage for Lexus and Tatiana to share their experiences. But before we go to those wonderful stories from them, we want to hear from Priya Cook from Children and Nature Network and how her organization is approaching this issue, specifically regarding the schoolyards. Thank you, Priya.
Thank you, Leyla, and thank you to the Children's Environmental Health Network for having this event and this discussion. It's so timely and so important. I join you all today. I guess I'll say good afternoon. I think we got good morning and good evening covered, and now anyone watching at any time, greetings. I work on green schoolyards at the Children and Nature Network, and I join you today from my home in Washington, D.C., which sits on the ancestral lands of the Anacostans, Nacotchtank, Piscataway, and Pamunkey people. And it's a beautiful fall day. Our mission at the Children and Nature Network is to increase equity in the access to the benefits of nature so that both children and the natural world can thrive. And as many have already noted on this panel, that there's an abundance of research that shows that mental and physical well-being is one of the greatest among those benefits. And so that's a really key priority for us. The three of the main ways that the Children and Nature Network tries to address this in our work are, first of all, by fostering and promoting a belief that a connection to nature supports the well-being of children. So that gets to what Robert was saying before. Why hadn't this occurred to me before? Why wasn't I encountering this in my work? So trying to spread that belief and that understanding across all sectors. Secondly, we work specifically on impacting the core systems that influence whether children get that daily connection to nature. So these are through initiatives such as our Cities Connecting Children to Nature effort, which we co-lead with our partners at the National League of Cities, where we work directly with municipal, county, and school district leadership to advance policies, funding mechanisms, and system-wide efforts that are implemented with an equity lens. And then the third thing is that we really try and grow the movement. So we provide lots of tools, research, and information for practitioners, for educators, for city leaders, parents, young people, youth leaders on the benefits of spending time outdoors. So for example, tools like our Green Schoolyards Advocacy Toolkit and our online resource hub have a whole section dedicated to the health and well-being benefits of nature, as well as, you know, any other way you might want to slice and dice the research. So those are a few aspects of our work, and I look forward to hearing more from the rest of these panelists and getting into more detail later on.
Thank you, Priya. There are so many resources that Children and Nature Network can provide to anyone interested in getting children outdoors in nature. And now I would like to turn it over to Lexis Morrow from Outdoor Outreach, and have her share some of the specifics of the work that they are doing there. Thank you.
Thank you, Leyla. And I'm really honored to be a part of this panel with all of these amazing individuals who are working in the outdoor sector to increase equity. As mentioned, my name is Lexis Morrow. I work as the development coordinator currently with Outdoor Outreach. I work mainly in the fundraising and financing and development section. But before that, in Outdoor Outreach, I was a participant. And during those 2 times, I worked as a youth programs assistant coordinator, where I helped co-found and co-facilitate Rady Children's Hospital to increase equity and access for those struggling with mental health and medical issues. As a participant and as someone who's gone through the program and someone from a low-income family and an under-resourced community, I found the benefits of working with Outdoor Outreach and working as a participant with Outdoor Outreach very inspiring and pretty life-changing, that I have gone on to speak with governors and senators and government officials to further increase equity to those in my community, as well as facilitate outdoor experiences so that those youth can see more diversity in the outdoors.
Thank you, Alexis. Those are really great approaches to the work that we need to do in this space. Clearly, we want to get the youth engaged, and you have a lot of influence with your peers, and you can bring your own perspective to guide these efforts. And also the fact that, you understand, represent those communities who may have been left out of this discussion and have not had the equal opportunities to enjoy the outdoors the way some other populations have been. These are critically important topics that we all need to think about. And I know Tatiana will be able to even provide even further insights into this discussion. And so I would like to invite Tatiana Butte from Outdoor Outreach to talk about these issues from her perspective. Thank you.
Thank you, Leyla, and thank you to everyone for having us today. This is an important topic. As Lexis, I grew up in San Diego, and where I am from, usually to get to the nearest environmental grounds, let's say like a beach or a desert, let's say a beach, for example, we're mostly known for our beaches. From where we live, it takes about 30 minutes to 20 to get to the beach by driving, yet it takes about 3 to 4 hours to get there by public transportation. And there's other factors that inhibit us, people of color and people who come from financial struggles, that it's unrealistic for us to go. And I, same here as Lexis, have spoken with state legislators, local and federal officials to enact to get more resources to our communities and to people of color who have been historically marginalized, excluded because of historical barriers and just so many barriers in general. And it is important for us to go outside because we need to experience it. It's a human right to experience the outdoors and to see the different opportunities. And my background is that I am very lucky and blessed to be a part of Outdoor Outreach, since they're the ones who first introduced me to kayaking under one of the most beautiful bridges in San Diego. And I've never done that in my life. And so through this, I'm able to be an advocate for environmental equity. I'm taking that with me through my time in school and through what I'm doing now with a environmental justice organization here in Berkeley. So I'm very happy to be an environmental steward and champion to be able to help the future generation and this generation proceed through other factors of environmental change and climate change and so much more.
Thank you so much, Tatiana. And you touched a really important topic here, is that, you know, we have talked about here about in general, how being outdoors in nature is helping children improve their health, not only physical, but mental health. But then there is the other piece about our environment, right? And the fact that through these programs, like you said, we expose children to nature, really helps them to have a connection with nature. And of course, if we love something, we have a connection, we want to protect it. And so I would like to open it up now to all the panelists. Maybe if you want to talk about some of the other benefits, such as these. Anybody can just raise your hand or jump in to talk about some of the additional benefits of having access, equitable access, right, to nature for our children.
I could hop in, Leyla. I think, you know, the benefits to access, true sustained access to nature and the outdoors, I think are multiple. And you'll hear across this panel several different perspectives, from the physical health benefits to mental health benefits, social emotional benefits, and even workforce development opportunities as well for youth through transformative experiences in the outdoors. I think one example of some of the mental health benefits that we've seen through outdoor engagement was the example that Alexis had shared. So we've been able to, over the past few years, partner with Rady's Children's Hospital here in San Diego to be able to run cohorted programs with groups of youth that are in their outpatient mental health unit. And what we've seen through those intensive 8 to 11 week programs are meaningful, measurable shifts in their pediatric or in their symptoms, in their mental health symptomology. We've seen increases in hope, increases in self-esteem, increases in resilience, as it's defined by the 14-item resilience scale, and so many other both quantifiable as well as anecdotal pieces that demonstrate resilience in youth. And Lexis has been such a phenomenal coordinator of that program in really helping youth to feel seen, heard in community. I've seen where youth that were completely shelled off and maybe struggling with anxiety completely open up to just a new sense of possibility through some of those transformative experiences in the outdoors. And so we see so many benefits there. I think another example of some of the mental health benefits that we've seen of engagement in the outdoors is over this past year, right? This past year has been so incredibly taxing on the mental health of our youth, of our families, of our communities as a whole, as a result of COVID, this huge pandemic that has shifted our way of life, to the awakening of America to racial injustices across the country has also equally impacted the youth in our communities. But what we saw last year, as we were able to run some outdoor programming in accordance with public health guidelines and really mitigating any risk of transmission, what we saw was the youth, the 1,200 youth that were able to get out with us last year reported back, 93% of youth reported that getting outdoors helped them to mitigate the impact of COVID. It helped them to overcome the household dysfunction that came from COVID, from families being bottled up in tight places over extended periods of time. It helped them to overcome some of the anxiety or fear or panic that really set in during closures, during the stay-at-home orders and so forth. And so, I mean, we could kind of share all day about the benefits of being in the outdoors, but we'd be remiss if we didn't dive in and talk about some of the barriers that's preventing that real public health solution, as Dr. Zarr had shared as well, to so many mental health and health issues that exist within our society. Oh, Leyla, I think you're muted.
Thanks for the warning. Thank you so much, Lesford. That was really a great way to summarize, how it does make a difference. And the fact that you were able to evaluate the programs, that really helps, I think, the entire community to feel even more confident that, these things actually work. One of the things that is in my mind is the fact that, some of us during these very challenging times, and for me, and I know for many people who have the privilege of living close to nature in a house with a garden or, parks close to your home, or trails close to your home. Despite the pandemic, we were able to get out and get these benefits that you mentioned. And then again, going back to the access issues, not all children have these privileges of, being able to just step outdoors and for the, benefits that you mentioned. And I would like to invite our panelists to address how we can increase that access so that all kids are able to spend time in nature.
Well, I can jump in. One thought is that helps guide the work that we do at the Children in Nature Network is to think about, yes, we definitely need to reduce barriers sometimes to accessing, quote unquote, big nature, which can require more transportation or backcountry or whatever you want to call it. But there's also a lot of value in just making sure kids can find nature where they already play, live, learn. So schools are a really obvious place to look in that regard. Kids spend a lot of their lived, waking hours at schools. And so that is kind of the basis for our vision that by 2050, all schoolyards should offer kind of nature-rich spaces for playing and learning, and to really build on the benefits that Les mentioned. In addition to those, there's kind of spillover effects of all of that mental health and mental, well-being. When you look within a school setting, there's studies showing that time outdoors can also improve academic outcomes. And this is so relevant right now as schools are really grappling with, how do we keep kids physically safe during a pandemic and also address their mental health as they come out of, a year and a half of real disruption. on top of whatever other challenges they might be facing. And regular physical activity, which tends to happen more in outdoor and natural environments, is shown to improve brain function in kids. And there's also documented improvements in reading, math, science, writing, and social studies. And then also, enhanced creativity and executive function, fewer behavior problems and challenges during the school day. And all of that increasing the enthusiasm for learning really has its own set of benefits just within that school setting. One aspect of the Green Schoolyards initiative is that, and there are many, many different organizations, of course, working on this. The reality is that unfortunately, most schoolyards across the country are asphalt. They are just blacktop, often used for parking, which contribute to a host of other issues too, right? Stormwater runoff, urban heat islands. And so there's really so many different benefits, that we could gain by transformation of those spaces. There's also the fact that public schools own 22 million acres of land across the country. So if you're a stormwater agency person, or you are someone working with more of an environmental or lens, there's room for city agencies, county agencies to really tackle a variety of goals in addition to mental health and well-being. There's also, I'm sure many folks are already familiar with Trust for Public Lands 10-minute walk to a park campaign, also focused on nearby nature and ensuring that everyone has a safe walk to a high quality park. And in many places, there isn't a lot of opportunity to install a new park, but what there is in almost every community are schools. And so when those schools can become green schoolyards, transformed, prioritizing equity, which sites are most needed first, to be happening district-wide and to be happening so that they are open access, open to communities after school hours. Those places become parks too, where it's not just benefiting the staff and the students in the building, but it's also benefiting the families and neighbors and other residents who can also benefit physically and mentally from those natural spaces.
Excellent points, Priya. Definitely, the schools can serve as not only for children, providing this wonderful nature experience, both during recess, but also as serving as a lab for the actual teaching and education. And on top of that, serving as a community gathering place for all the, the physical and mental health benefits through the generations. As we know, we are talking about children here, but, it's really important to keep all community members healthy. And we hear a lot about the elderly isolation, and the older generations can really help the young people because parents may be working, and older people who may be retired may be the ones through community connections can be the, I'm not going to say caregivers, but mentors and supporters of children. And that interaction is clearly helpful, not only for the child, but for the older person, and then it benefits the community overall. So from the way you explained the benefit of having the schools to invest in natural spaces can really have, really huge impacts on communities and lifting them up. Thank you so much. And I wanted to turn it over to Robert to hear from the healthcare provider perspective, how some of the things that we are hearing from the other panelists from the ground up, and I know you're very connected to those communities, but just basing it on some of the things we hear today, what are your responses?
Yeah, it's really just a joy to hear all of you sort of share your perspectives and to share your stories. And, I've spent, all of my professional life, listening and taking in all these stories. And I think that is perhaps maybe one of the most important pieces of what we're all experiencing right here and now, which is to really listen to each other's stories. I felt different after listening to Tatiana tell her story of kayaking for the first time in a setting where she had never done something like that before. And for many of my patients, I often, in the trainings that I've done with hundreds, if not thousands of doctors around the world, I say one of the most important things to do if you want to do this, to institute this nature, based intervention in your visit, is to ask the right questions and listen. And the first question I invite them to ask their patients is, where do you feel safe and comfortable, outside, right? I mean, we're getting at that, right? So a little bit of a pause in there, and you add the outside. And that's where you start. You start with the right question, and then you listen. Yesterday here in Canada, where my family has relocated, was Canada's first day of truth and reconciliation. A really important day. And Priya, thank you. We're all remiss except you in recognizing native lands. So I really appreciate that. And yesterday I spent the majority of my day listening to stories. Pause, listen, see what those experiences, how they've shaped the lives of the people around us. And I think that is kind of where I wanted to kind of focus a little bit. I just love the fact this conversation is really centered around issues of diversity and equity and inclusion. I mean, really, and I think it might have been Tatiana who talked about sort of structural barriers. And we haven't mentioned the word racism yet, but structural racism is a very, very important part of everything that we do, including nature and health. So, from my perspective, as a physician, I just want to say, that I am in admiration of the work that all of you do, that is not based in a hospital or a clinic setting, because, really the prescription, as I see it, is just the first step, right? I see them for 15, 20 minutes, and then I don't see them for 3 months, at best maybe a month, but there's an interval of time between visits. And, as Lesford pointed out, there is all of this space and time that needs to be filled up. And I can't go home with them. So there needs to be safe and comfortable environments. There need to be, warm handoffs, so, and they need my community needs to feel safe and comfortable. Otherwise, my advice is really empty, One of the things that I really focus on in doing the trainings with other healthcare professionals is in getting a sense of where their patients, where their clients feel safe and comfortable. What do they like to do? What are they willing to do? How often are they willing to do it? And with what frequency? But once again, it has a lot to do with where they live. I think one of the short films that this audience will see is Nature, No App Required, which is really a story of transformation, which I think is a word that Lesford used earlier. And that's what the producers of this documentary were really trying to capture, was a transformational experience. And it doesn't have to be kayaking. It could just be opening your window. And if that's all you have at that moment, taking a breath of air, breathe. One of the things that I did in the last couple of years was get myself certified to be a nature and forest therapy guide. And it was a struggle for me because I am a doctor and I want to do my doctoring, but I had to learn to be a guide. And really the therapy, is nature. The therapy is in the relationship between us as human beings and nature. And maybe focusing on that as we need to as individuals is something that we sometimes forget about from the policy side of things, which is still very important, obviously, because it's the policy that creates these opportunities for us to have these individual rich experiences and to do it safely and comfortably and not feel threatened. So I think my feedback or sort of thoughts on this would be to keep working together rather than in silos, which is just generally what a lot of us end up doing by the nature of our work and the business of our days. And to remember we're out there and we're all trying to do a similar thing, but from different angles, different perspectives. I think it was Priya who said, that we have to really think about the places where children, live, work, and play. And we could add to that. We could add to that a number of other areas, right? And one of the ones that comes to mind for me is where children get care. Can you imagine? These children are coming to these sterile nature, void buildings with no natural light. There's no play area. There's no outside area. And they wait for hours sometimes to see a doctor for 15 minutes. Well, and if you're chronically ill, you're going to spend a good chunk of your life in that clinic. And I've seen some great examples of how to do it better. I know in Conroe, Texas, for example, the Lone Star Family Medical Center has an outside playscape. How did that happen? It happened because of a relationship between that clinic and the U.S. Forest Service, which is part of the U.S. Department of Agriculture. So there are relationships out there that can extend these places and these environments that are necessary because it can be transformational to play outdoors while you're waiting for your doctor and to experience something that you would otherwise never perhaps experience in your entire day or perhaps the entire month, right? Because if your playscape is really a black asphalt at your elementary school, maybe the only place you'll see that kind of a beauty in your life might be at the doctor's office. So just to sort of think a little bit beyond the places that we normally try to address and ask questions that also imply the safety and comfort and health of those who are providing that care. In the US alone, we're looking at tens of millions of people who are providing some kind of health care. So it's not just the 1 million doctors, but everybody else. And if you look at the environments in which all of us work day in, day out, these are not the kind of environments that are conducive to the kind of advice we want the healthcare professionals to give. And when you dig a little bit deeper, which none of us like to do with healthcare professionals, you find that there's a lot of depression and there's a higher rate of suicide. There is a higher rate of alcoholism and drug use and fatigue and burnout in these healthcare professionals. And this is not helping the healthcare professionals or the people they serve. So I just think that there's a lot of areas to think about that would have a overreaching, good effects in multiple populations.
I'd love to piggyback off of what Dr. Zarr shared, and you packed in a lot of really powerful points. But I think one of the key takeaways that I take from that is, also expanding the notion of the healthcare professions, right? So expanding beyond, who is a healthcare provider. I think Dr. Nashim Razani kind of coined the term also of outdoor providers or nature providers as well, as being healthcare providers as well. And that could be anyone. That could include our teachers. That could include our social service agencies and so forth. Like when we think of the broad spectrum of who is included in health, and how that then connects back to nature. Usually by the time a patient is seeing you, unless it's for like for a wellness checkup, usually they're at a point where they're already experiencing dis-ease or disease. And so, kind of thinking further upstream as we do as public health professionals, how do we promote positive health outcomes further upstream by integrating outdoor access and outdoor equity? And so to that end, I often share that lack of outdoor access, or the barriers to outdoor access, are really public health issues, public health crises. What I mean by that, right? So I wouldn't want the audience to kind of walk away from this conversation wondering, like, what are the barriers to access? Someone could just walk right outside and walk to their local park, or walk to, and as was alluded to in this panel discussion, there's so many communities that, even if there's a park nearby, it may not be safe, it may not be clean, it may not be well maintained, right? And that's if those parks exist in the first place. Here in San Diego, when we look at a map, and a map was put out in the Parks for Everyone report published by the San Diego Foundation, it shows a high rate of communities south of the 8 freeway that have less than 3 acres of green space per 1,000 residents, right? And you compare that to our neighbors just north in La Jolla or in other parts of North County, and we see a tale of 2 completely different cities, right? So addressing that nearby nature, as Priya mentioned, as well as access to more far off nature as well, is truly a big part of improving the health of our communities, so that we're improving that health further upstream rather than, and I do believe it needs to be integrated into medicine, as Dr. Zarr mentioned as well. It needs to be integrated into mental health care as well. But how do we create a true, robust healthcare system that addresses health on the front end, to alleviate some of the bottlenecks that we see in our healthcare system and in our medical system?
I'd love to, sorry, Leyla. I would love to piggyback off of both Les and Robert from like an anecdotal standpoint. As someone who lives with a chronic illness and also working with children with mental health and medical issues with Rady's Children's Hospital, most of the things that I saw were a lot of youth coming in with stress, and someone whose chronic illness does primarily deal with stress as a factor. I noticed with a lot of these kids that when being outdoors, that stress that is alleviated tends to help alleviate those medical issues and mental health issues that they see. Talking with these youth, and as Les mentioned, seeing these youth who come in with hoods over their heads and headphones in their ears and cut off eye contact in complete isolation with themselves, being surrounded by individuals, to at the end of 11 weeks chatting, talking about how they met their best friend through our programs. It does go to show you that nature is an access to each other. It creates a barrier, but also a bridge that allows them to connect with each other through a way that is more open than a lot of other spaces, like in schools or in doctor's offices or at home. But at the same time, I do notice that with the youth that we work with, like Rady's Children's Hospital, probation, things like that, that the lack of access to the outdoors is a big factor in what causes a lot of the stress that they have to deal with. Talking with them about school is a big factor when it comes to a lot of stress, but these kids are making best friends when they're allowed to be in the outdoors with people, because the outdoors is a bridge. But I hear all the time from the youth that I talk to that just going outside is, after going through our program, that they know that that's somewhere that they can relieve stress, that they can be healthy, that they can unwind. And when life becomes too tough, when school is too hard, when situations at home is too difficult, that going outside helps them, that just walking outside, going to a park, sitting under a tree and reading a book is what helps calm them down, what helps make their day sometimes. And so, you know, talking with these youth about rock climbing and how they learn different perspectives and understanding different perspectives, that our whole goal is creating transformative, you know, outdoor experiences, but also to connect those experiences to life situations. And talking with these youth who have connected them by themselves, saying that if they can climb a rock wall, then they can get through high school. If they can, as they climb a rock wall, they realize that they have to shift their body in different ways, and they have to kind of take a step back and look at the wall in a different angle. And that helps them with life, because they know that there are different challenges that they have to face, that they have to use their body in different ways and use their mind in different ways to overcome it. So I hear, as a field instructor and as a coordinator and as someone who was a participant, that these anecdotal stories every day, that these youth are learning something far more than possibility, but that they have their own possibility, that they have their own inner power and own empowerment of themselves when they have access to the outdoors.
Thank you all so very much. We're coming to the end of our time, but I wanted to give an opportunity to Tatiana as, someone representing the youth perspective. If she could just say a few last words to all of us here, what we can do to make sure that all children are really able to, without barriers, to have nature as part of their life, as a critical component that's going to help them. How can we make that happen? Are there any parting words you would like to leave us with?
Thank you, Leyla. That's a pretty big question. But I'm happy to give my 2 cents on the matter. And that if you are not able to go outdoors due to big barriers or barriers of yourself, family, environmental, the only thing you could do is try. And I want everyone on this panel and those listening in to know that you can try to make an effort to go outside, even if it's just for 5 or 10 minutes. Studies have shown that even 10 minutes outdoors can alleviate a stressor or just alleviate so much. And for all those who are champions who want like outdoor outreach and Children Nature Network and Dr. Robert Zarr for his efforts, that if you can't go towards the outdoors, and these organizations are trying to bring the outdoors to you. And so I want everyone to try and look into different resources of outdoor engagement and such, like opening up your window, getting some fresh air, walking outside for just 5 or 10 minutes, and just understanding that you're in a here and now moment. And I always stress that to so many people, that a here and now moment is just being in environment or just being within yourself, just let's say 5 minutes, and you can just not think about what's going on within stresses of the pandemic, home-related issues, your own issues itself. Just know that within a moment of being outside or just being able to breathe in the fresh air, you could just be in a here and now moment and just think about the blissfulness of just being here in the moment and listening to a bird chirp, listening to the cars go by, or just listening to life. And I want everyone to know, if you're in a here and now moment, you're listening to life. And to everyone on the panel, I'm so grateful to be here. And we can all do it. I know we all can. We can be outside. We can champion our waves to environmental equity, environmental health. In any way, the environment is here for us. And through this pandemic, we know we all took it for granted. And I know now that we're outdoors or assimilating back to the outdoors, we can all find our way to a here and now moment.
Thank you, Tatiana. I think those were great closing words to this wonderful conversation we had. And I could stay on forever to listen to all of you, but we will have to wrap it here. And again, thank you so much to all of you, and thank you to all our viewers. As Robert mentioned, there are some films online. If you haven't seen them, please take a look. They also really complete the picture. There are some really great examples about the topics that we try to address in this panel. Again, thank you all very much. So now let's all go and take our children outdoors to enjoy nature for all those benefits that this wonderful panel discussed. And we know that all our children deserve it. Happy Children's Environmental Health Day, and thanks again.